Good afternoon, everyone. Thank you so much for joining us. My name is Jennifer Rubin with UC Davis Health, and I'm joined today by...
Hi, everyone. I'm Liz Godfrey. I'm with Rebuilding Together Sacramento.
And we are here today to talk about preventing falls. We know that as we age, we sometimes are not as agile as we used to be and are at a greater risk for falls. So we want to talk about some of the reasons why we're at greater risk as we age, and then let's spend a lot of time on what we can do about it in addition to what's happening. So if it's all right, let's go ahead and start my presentation. So as I mentioned, I am joining you from UC Davis Medical Center. And one of the things that is special about the Med Center is that we are a level 1 adult trauma center, meaning that you can come to us if you are injured, and we treat injuries. And my job is trauma prevention, and I am charged with treating our leading cause of injury. And you can guess by our topic today what that might be. Unfortunately, our overwhelming leading cause of injury that lands folks in my emergency room is falls. And we know a lot of those falls can be prevented, so let's work on that today. We're going to talk a bit about the fear of falling, what some of those risk factors are, and then some action steps you can take to reduce your fall risk. Right? Okay, so first let me ask those in the crowd and those listening online, have you had a fall in the last year? And a follow-up question, I'm getting some no's, some no, okay, good. Here in the room we're saying no, but we're still thinking about it. And then if you have had a fall, did you tell your primary care provider? Have you opened that line of communication? Have you let them know that that's part of your world and part of what makes up the full picture of your medical situation right now? Were you hurt? And then for everyone, do you worry about falling?
Oh, yeah.
Oh, yes. Mm-hmm. Okay, so do you start to feel unsteady when you're standing or walking, or notice that you're a little more unsteady than you used to be? All right, so if we answered yes to any of those questions, then you're in the right place. You've come to the right place to discuss these topics today. Because unfortunately, a previous fall does increase your risk of future falls. So if we want to know if we've had a minor fall, then it's time to start addressing this topic. So you've come to the right place today.
Does it matter why you fell? I mean, maybe you tripped over your cat or something.
Great question. Someone in the room asked, does it matter why you fell? You know, maybe you tripped over your cat or something like that. You know, as we go on, we'll see that all ages fall, right? Everyone falls in the world. Children fall, I fall, you fall. But as we age, the consequences of falling, what happens when we hit the ground, is certainly different than it was when we were young. So that's why we want to work to address it. Okay, next slide, please. All right. Those of you who have not had a fall, but you still came here today because you are concerned about falls, why does that matter? Why does the fear of falling matter? What we find is that when folks are afraid of falling, they may start to restrict their activities, right? You think, okay, if I stay right here in my favorite chair, I'll be fine, right? Out there in the world, that's what's dangerous. Let me just stay right here and things will be safe. But that is actually risky from sitting too much, because think of the consequences of sitting all the time, right? Our legs may start to weaken, we may start to stiffen up, lose some of that muscle mass you've worked for over your life, and our physical condition begins to deteriorate. So actually sitting all the time is harming us, believe it or not. It could also lead to some social consequences, being isolated and not going out and doing the things you enjoy. Right? That's what we want to empower you to do with this presentation, is to prevent those falls and that fear of falling, so you can get out and do the things you enjoy. You can come here to ACC and take advantage of all their amazing classes. And staying home all the time can certainly be isolating and can even lead to depression. So we've learned that fall and injury risk does increase with age. Like I mentioned, we may see those decreases in strength from inactivity or just from overall aging, some changes in balance, and even a loss of bone mass or some sensory deficits. Things like our hearing and our vision aren't quite as good as they used to be. Now, Next slide, please. You've noticed that I've gone through quite a few risk factors already, and we'll look at a list here. And what's interesting about this is we each have our own combination of risk factors, right? Different things on this list may apply to each of you. If there was just one cause of falls, well, you wouldn't even need me today, would you? If there was just one cause of falls, then I could help you solve that cause and we'd move on. But it's not. It's a pretty long list. So there are some things we have control over and some things we don't. So first, we can't turn back the clock. We can't modify our age as much as we might want to. So aging is a risk factor. Our sex assigned at birth does present some risk for things like women are more likely to experience osteoporosis and such. Our frailty from a chronic illness, that may be something we can't control. And then our history of falls. And last, impaired cognition. So conditions like dementia are a fall risk for those who may not understand the world around them as much as they used to. Okay, I'm not going to leave you with just the things you can't change. Let's focus a lot on the things we can change, the things you have a lot of power over. First is our strength and balance. And we'll talk about making sure we're getting exercise and increasing our level of activity. We can work on our vision, make sure our vision's checked, our home safety environment around us, which Liz is going to talk about today. We want to keep up on our medications, making sure they're not harming us or causing a risk. And then our fear of falling. Okay, so let's go in depth on each of those. Next slide, please. Okay, the things we're not going to go in depth today, there are some additional conditions that you could speak to your doctor about. Right? If one of these things on this list it does impact you, make sure to talk to your doctor about anything going on with vestibular dysfunction, your balance. That might be something with your inner ears or a condition that is causing some imbalance there. Also, anything to do with neuropathy or your gait. If you've lost some feeling in your feet or other areas, it's worth talking about. And then dizziness, that postural hypotension, which is a sudden loss in blood pressure. And this happens at all ages. Have you ever stood up really fast and gone, whoa? That happens to all ages, but if it's started to happen more often, then it would be good to chat with your doctor about that. Okay? And then Alzheimer's disease can cause some changes in our cognition and gait, and so we'd want to chat with our providers about that. Okay? All right, so as I mentioned, there are a lot of different risk factors impacting us. And so we need to have a multifaceted approach. So as we go through this, I'd love for you to think, what on this list applies to me? Is there anything here that I've experienced and that Jennifer is telling me in the presentation today I do have some power over? I understand it might not be all of them, but let's see which ones apply to you. Okay. I can tell you which ones apply to me. For example, I wear glasses, as you can see, so I need to keep on my vision management. I live in a 2-story home, and so I want to be thoughtful about my stairs and using my handrails and being thoughtful about my home environment. And then, just like everyone, I need to stay on top of my exercise and activity level. So, all right, next slide, please. We want to make sure you have an individualized plan, so you're going to take some of our very general advice today and ask your personal healthcare team about an individualized plan just for you. What are your symptoms and what can you do to manage those? Okay, next slide, please. All right, so the first pillar of fall prevention we're going over is exercise. And I'm so glad to be talking about this here today in the ACC facility because they have so many amazing classes here. I saw just quickly on the list, there was Tai Chi, there was a strength and balance class, all kinds of good things. But exercise is key for fall prevention because an object in motion stays in motion, right? Motion is lotion. And so if we're continuing to move, continuing to stay active, we're going to avoid having our joints stiffen up, and we're going to be strong and flexible, right? Strong and flexible. Because if we fall, if we were 5 years old, what would happen?
Nothing.
Well, nothing. One of our participants said nothing. kids practically bounce right back up, don't they? It just seems like nothing is wrong with them because when they hit the ground, they're so flexible that they're not going to be brittle and have bone breaks and other injuries.
They're closer to the ground.
And they're closer to the ground, someone mentioned, absolutely. So it's not as big of a deal to fall. But for us as adults, when we fall, we've got a long way to go. And if we're not flexible and if our muscles don't have a good range of motion, that's when we experience those muscle tears or, unfortunately, those bone breaks. So let's stay both strong and flexible, right? Okay. There are a lot of evidence-based exercise programs out there. Some are offered here at ACC, Qigong and Tai Chi, and then some of your more non-traditional things can also be wonderful forms of exercise. Dancing, and then there's some great boxing programs happening around town for folks with Parkinson's disease. I've heard they just really enjoy those. And then there's even some virtual reality programs out there that are being tested. But just find a way to move that you enjoy and that you'll do on a regular basis.
What is it about boxing that helps?
Boxing, yeah. One of our participants asked, what is it about boxing that helps? It's that mind-body connection, similar to Tai Chi, where we're being well connected between our mind and body and controlling our own movements. And then it's just good strength and cardio training. I will say I'm not an expert on why it's beneficial for folks with Parkinson's disease, so those folks may want to learn more about it, why it's beneficial specifically for them. But good question.
I may take up boxing.
All right, we've got one person that wants to take up boxing. Wonderful. Next slide, please. All right, so now that I'm encouraging you to get out and move, I don't want you to say to me, Jennifer, you said to move, and I did, and I fell. Let's avoid that. So our safe mobility tips, we encourage just going for a walk as a low-cost way to get started. But we want to make sure to walk heel-toe and not be dragging our feet and causing us to trip over small objects. We want to scan ahead. And by that I mean let's avoid walking while looking straight down, because then we won't see what's ahead. And we can't look straight up the whole time, because then we'll miss what's on the ground. So we want to scan ahead. Here in our beautiful city of trees, we have lots of broken up sidewalks, don't we? So we want to scan ahead and see what's on the ground. You might consider using a mobility device like a cane or walker if your doctor has suggested it. We also see a lot of friends and some of my family members really enjoy the walking poles. Yeah, have any of you tried those? Yeah, we were visiting, my mom and I were in a foreign country actually a couple weeks ago with a lot of stairs. And she found that using walking poles was very helpful to have another point of contact with the ground to get up and down the stairs. Yeah, not necessarily flights of stairs, but in my uncle's garden, there were gradual steps going up. And having those walking poles was just a wonderful benefit.
Is it for a better balance?
Yeah, someone asked if they're for better balance. Yes. The walking poles were originally intended for folks that are doing hiking. And folks have found that they have those same benefits just out doing regular walks, providing another point of contact with the ground to help you stay steady. Yeah, and I think sometimes they look more sporty than a cane, and so they might, folks,
Upper body.
yeah, and someone suggested they're using their upper body as well, so they may make folks feel more confident. Okay. So before we leave this section on activity, I want to mention a frequently asked question. I get asked a lot, Jennifer, are you going to teach me how to fall? I said, well, not today. It's not something we can accomplish in our hour together today. There are folks who have learned a safe way to fall through years of practice of maybe martial arts or a certain sport. And if you feel like that's something you want to learn, you could speak to a physical therapist and schedule supervised times to practice some of those techniques. I don't want anybody doing it at home by themselves. But if you've got some supervised time with a physical therapist one-on-one, I think that's a good question for them. Okay? All right. Okay, so we mentioned exercise to improve our strength and balance. We want to continue to challenge ourselves and move up. If you've been doing the same thing for a lot of years, maybe now would be the time to add an extra day a week, or add a few more pounds to the weights, or mix it up and try a different class 1 or 2 times a week. And really find a program that works for you, something you're going to enjoy. I'll tell you what, I'm not a runner. You're never gonna get me to run on a regular basis, but you could probably get me to dance class a couple times a week. Okay, next slide, please. All right, so education or exercise is our leading pillar of fall prevention, but let's mention a couple other things that we want to monitor. So first would be our medications. Our medications are there to help some sort of condition that we're experiencing, and we want to make sure they're helping us and not hurting us, right, or causing further risk. Next slide, please. So the biggest risk to us is when we have multiple medications, sometimes prescribed by multiple providers, right? You've got your general practitioner saying one thing, and your podiatrist saying another thing, and your cardio doctor saying another thing. So let's make sure we're all on the same page. We want to make sure those medications aren't counteracting each other. And some of the side effects that might lead to increased fall risk are things like drowsiness or dizziness, right? Or even blurred vision. And so if you've noticed recently when you changed medication or changed your dosage, and now you're starting to experience some of these things, let's talk to our doctor about that. Okay. Even if it's helping one condition, we don't want it to also cause falls. Right? Next slide, please. So let's ask, what does this drug do? Right? Why am I taking this medicine? You know, before I left, you said about a lot of long scientific sounding names, and what are they? What are they for? How should I take this medication? Right? What time of day? How much? With food? With water? You know, how am I supposed to take this medication? Because that could make a big difference, especially for things that might make you drowsy. Maybe we could, if it's making you drowsy during the day, maybe we could ask our doctor if we could take it at night instead, right? And then when we're agreeing to a new medication, let's ask, hey, what side effects might I experience from this medication? Yeah, okay, I know it's, sorry, before we go from that. So let's ask our doctor if we could do a review of all of our medications. But another person that might be great to help with that would be your pharmacist. Yeah, because they've got the big picture, right? They can see your full list. And their job is medications. That's their whole world. They're an expert in medications. Your doctor is an expert on your body and your personal story. But the pharmacist can see the big picture of all of the different medications that you've been prescribed. So they're a great person to talk to. Great. All right, another place we want to check in is with our vision. Some of us may have postponed or put off our vision checks during the pandemic, but if it's been a while, now is a great time to check back in. And normal vision changes with age. Over the years, our eyes, like the rest of our body, start to slow down a little bit, and they may need some help. So we may experience a decrease in light and contrast sensitivity, a loss of some of that peripheral vision, especially if we're wearing glasses. And then on top of that, we may experience some medical conditions, things like cataracts, glaucoma, some degeneration, and possibly even eye disease related to diabetes. So it's time to check in if we can. I understand that glasses are expensive, right? We want to be thoughtful about what our insurance will cover and not cover. But let's try to, if we can, get a vision check once a year and update our glasses when needed. And if you are updating in a big way, right, you're getting a big change to something like bifocals now or trifocals now, that's a big change. And give yourself some grace in that transition, some time to transition. Okay? I got new glasses today. Whoop. Let me make sure I'm not going anywhere big today. Let me take time to experience these new glasses. What do things look like close up or far? or when I'm scanning ahead when I'm walking, right? And then driving. How are these new glasses going to work out for me when I'm driving? So if you're getting new glasses, if you're experiencing a big change, give yourself some time and some grace to get used to them. Next slide, please. Okay, so as we mentioned, let's get a checkup on a regular basis. We do want to pursue that cataract surgery if we can. Eye surgery does sound a little intimidating. It's becoming more common, so I'm guessing if you ask around to peers your age, somebody might have had it before and they can give you some confidence and say, I went through it, it wasn't so bad. Yeah, okay, and let's maintain good condition of our eyewear. I know when Liz and I sat down today, we both cleaned off our glasses. And it's funny when you, if you're ever standing in line at the pharmacy, here's kind of a busybody thing to do. Look, kind of tilt your head to one side and look through everyone's glasses, and you'll see often a lot of really dirty glasses, right? A lot of kind of dirty and kind of scratched up, but we need these to have access to the world. So try and care for your glasses as much as you can. Keep them nice and clean. It sounds small, but it's a big help. Okay. All right. So normally this is the part of the presentation where I touch on home safety, but Liz is going to do that for us in a moment. I will just say that the full complement of fall prevention, right? We've talked about exercise, we've talked about maintaining our medications and our vision. Home safety really is another big pillar so that the environment around us is helping us and not hurting us. Okay, next slide, please. All right, so how do we reduce the fear of falling? Well, I wish I could give you a booster shot of confidence, but you can absolutely improve your confidence by tackling some of the topics we talked about today. Participating in a regular exercise program will increase your strength and balance, and probably even your mood a little bit. We get those good endorphins that come from exercise. And then there are some cognitive behavioral interventions, they're called, which is a fancy name for let's get together in a fall prevention class and talk about it, okay? Let's talk about what's going on, because the fear of falling is a feeling, okay? And often getting together and sharing our feelings and addressing some of the reasons behind those feelings are going to help improve the situation and hopefully reduce that fear of falling. So I'll name a few classes that fit that category in just a moment, okay? So, sorry, back one slide, please. Back one, there we go. Okay, and then just that peer support. Those of you that have joined us today for this presentation, all right, I'm deputizing you now. I'm making you part of my fall prevention team. I would love for you to please go out and have this conversation with some of your friends. Ask if they're afraid of falling. Ask what makes them feel more confident or less confident. Right? By talking about it and knowing that we're not alone in this situation, that can really help us out. Okay? So that peer support and making our fall prevention team. Okay? Who's on our team? It's our friends, it's our healthcare providers, it's our service providers, like Rebuilding Together, we'll hear from. It's the folks that here at ACC offering all these amazing exercise classes.
You know, it's odd.
Yeah.
I was talking to a male friend of mine. We walk, and I actually have been trying to talk him into coming to some of these classes.
Yeah.
I don't know why men don't think they need a class like that.
Yeah.
But he's having second thoughts about it because when he walks, I don't know why he walks that way. He kind of walks, you know, he doesn't walk straight up. He kind of is.
Leaning forward a bit.
Yeah.
It's probably his back.
Yeah, one of our participants is mentioning that she has a male buddy who walks with her, and she's been trying to convince him to come to exercise classes, and he seems a little hesitant to do so. And she also mentioned she notices that when he walks, he's leaning forward quite a bit, which somebody mentioned could be due to back pain or something similar.
I don't think he has any back that
Yeah,
problem. So
okay.
I told him that, and he straightened up, and
Yeah.
he'll probably be coming to some of the classes.
Yeah, that is interesting. And in a lot of fall prevention classes, I do see more female participants than male participants. What do you think? One of our participants in the back, why do you think that is?
Well, I think it's just how men are. They don't like to go to the doctor.
Yeah.
It's usually the wife, they get complained, and the wives have to push them to go.
Yeah.
It's just how they think. They think that it is Superman. Nothing's gonna be wrong with them, I think.
Yeah. Is it? Yeah, it could be a combination of things. Is it?
We need to go because we're keeping the wheels turning, so we go. But they just, I've heard so many of my friends say that about their husbands. They just have to keep hammering away until they get so frustrated, they get so angry, they say, okay, you're going.
Yep.
We shouldn't get to that point, but that's just the way.
I know. Is it overconfidence? Is it the reticence to ask for help, or to get to the point where we realize we need help? Or is it more of an urge to do things as an individual rather than as a team with our peers? Yes, I do hear that a lot, that a lot of,
They think it's just, well, that's women.
yeah.
It's just-
But men
It's not a
don't
male
have a
thing.
lot of those kind of bone issues.
Yeah.
I think that's a big reason why a lot of men don't think it's that important.
Yeah, when someone suggested maybe they don't seek it out as much because they don't have some of those bone issues. So yes, I do think it might take some extra convincing to get some of our male counterparts to the exercise class or to the fall prevention class, but the effort's certainly worth it. So I appreciate you trying to get your friend out there. But you're already really helping by taking those walks, so,
Well, and
yeah.
He's younger, he's 15 years younger than me. So
Okay,
I think he's just thinking it's not gonna be a problem.
yeah. So keep taking those walks. All right, great. Next slide, please. So today we've given a lot of general advice and a lot of general tips, but I would love for you to see some personalized information. And so the National Council on Aging has something called the Falls Free Checkup, right? And hopefully we'll send out that link after the event, but you can also look it up. If you look up in your search engine there, Falls Free Checkup. And this is a short online quiz. They're yes or no questions, and it'll create a summary at the end, and it will email you a summary of the results. And you can see if you are at risk for falls. If you'd like to, you can then share that survey with your doctor or anyone else, or just keep the results for yourself as a little test of, hey, how's my fall risk doing? It'll ask questions like, have I had a fall? Am I feeling unsteady? Do I exercise regularly? Some of these leading risk factors. Okay? So I like that one. It's a nice short online quiz, yes or no questions. Okay. Next slide, please. All right, so please feel free to contact me. I think what we'll do is we'll have Liz share her information about Rebuilding Together, and at the end, I can talk about some local fall prevention classes. All right? So feel free to contact me if you'd like information about fall prevention classes at UC Davis. And if you're not a UC Davis patient, I can point you towards one in your neighborhood from another provider. All right? Okay. So we'll leave some time for questions at the end, but right now I'm going to hand it off to Liz with Rebuilding Together Sacramento.
Thanks, Jennifer. That was a great presentation. Tough act to follow. Hi, everyone. I'm Liz Godfrey. I'm with Rebuilding Together Sacramento. I'm our resource and development manager, and Jennifer is actually one of our board members. So today I'm going to talk a little bit, mostly about Rebuilding Together Sacramento, and also how you can kind of make sure your home is safe and accessible for you. So we can start. Perfect. So Rebuilding Together Sacramento is a nonprofit here in Sacramento. Our mission is repairing homes, revitalizing neighborhoods, and rebuilding lives. Today we're going to talk about Rebuilding Together Sacramento, our services, eligibility for those services, and the application process. And next slide, perfect. So we are a 501c3 organization. We focus on safe and healthy housing for everyone in Sacramento County, East El Dorado County, and then we actually just started supporting Northern San Joaquin County. We primarily serve older adults, those with disabilities, and families with children. We are one of 120 nationwide affiliates. Rebuilding Together is a national organization, and Together Sacramento is one of the affiliates, and we were founded in 1991. We approximately serve 350 homes per year throughout all of our programs, and since 1991, we've provided home improvement and modifications to over 8,500 homes.
Wow. That's a lot.
It is a lot. So our services are our Rebuild Day events, which primarily are in Rancho Cordova right now. That's where we'll overhaul a home. We'll do plumbing, landscaping, electrical, things like that. Our critical repair is in Citrus Heights in the city of Rancho Cordova, and that's where we'll do roof repair, HVAC systems, water heaters, everything like that. But the primary focus that I want to talk about today is our Safe at Home program, which is for all of Sacramento County, as I mentioned, part of El Dorado and part of San Joaquin. Go back really quick. So actually, I'll go into Safe at Home in a little bit. So yeah, next slide, please. Thank you. Eligibility for all our programs is very similar. It varies slightly per program, but it's 100% free for low to moderate income homeowners. The homes have to be owner occupied. We're working towards doing rental homes as well right now. You do have to submit an application for our services, and we do come by and do a preview of your home just to make sure that we can provide our services to your home. Next slide, please. So Safe at Home is a really cool program that we have. It's where we provide home safety modifications to a home. So we might install grab bars, we might do a ramp, modified steps, things like that. And so to talk a little bit more about safety in your home, there's a lot of factors that go into this, as Jennifer mentioned. One is just making sure that your walkways are clear, you have good lighting in your home, you don't have wires that you can trip over in your home. That's a huge factor to it. And when we come to do the home preview that I mentioned before, our staff and volunteers do kind of look at those to make sure that there isn't those little changes to your home that can be made for your safety. It also includes checking to see how comfortable you are getting in and out of your home. Is there a certain area of your home you're not comfortable going to because you're afraid you might fall, whether it's upstairs or trying to reach into the back of cupboards, things like that. Are you nervous when you have to get into your shower? Do you have to do a high step over a bathtub? When you're using the restroom, are you comfortable getting up from your toilet? Things like that, there's so many factors that come into the safety of your home. And Safe at Home, sorry, just touched the microphone. Safe at Home is a program that can really help you with that, because like I said, we'll come in and do an evaluation, kind of help you with the safety of your home, but we'll also do things like install grab bars that you may need in the shower. We might put a grab bar in your garage if you just need that extra stability getting into your house. We'll do an evaluation if you need a ramp or modified steps. And I'll show you a few of those items in a little bit later, but that's just to reduce the risk of falling. Did you want to add anything, Jennifer?
I think the way I look at it is your home has grown with you, right? And it hasn't been the same over all these years. You've redecorated, you've modernized, right? And your home has changed over the years to fit your needs at the time. And so don't be hesitant about changing it now, okay? Change it to fit your condition now. It needs to work for you today. Right? You changed your home to fit when there were small children. You changed your home to fit when there were teenagers. So you've been changing it for different stages of life over the years. So now let's change it to fit who you are today and make sure that it's helping you stay safe where you spend the most time, which is at home.
Thank you. Mm-hmm. All right, next slide, please. One of the unique things we've recently added is we do have an occupational therapist on hand as well. We do have limited availability for her, and she doesn't go to every house, and she certainly does not replace your current provider. But on specific needs, depending on the applications we receive, we do have her go out to the homes, which is really great. And she will do an initial evaluation of your home's needs. Our staff and volunteers will come in and do any changes she has has suggested, and then she'll come in and do a follow-up assessment to make sure that all the homeowners' needs were met. Next slide, please. So now I'm going to talk about a few of the items we do provide. Grab bars are a big ticket item for us. So we will install as many grab bars as are needed in someone's home. So we will do a grab bar by your toilet seat if needed. We'll put one in your shower so you can safely get in and out. Like I said, we'll even sometimes put them in the garage or certain places around the house where you just might need that extra thing to hold on to safely get around. Next slide, please. We will add shower and bath aids. So we might add a mat, we might add a seat to your shower just to give you a little bit extra stability and safety within your shower. Next slide. We will install toilet seat risers, so that's just to make it easier for you to sit down and get up from the toilet. We will do transition ramps and regular ramps, and this is to help people get safely in and out of their homes. A lot of times we'll have people call us who haven't been able to leave their house for months, and so we'll get out there just to make sure that they can safely get in and out of their homes. We always check carbon monoxide and smoke detectors. We will install new ones as needed. That's definitely an important safety feature to have in your home. So make sure you check. That's another factor you should all check, is that your smoke detectors, your carbon monoxide detectors, and also your fire extinguishers are still working and up to date. We'll install handrails down hallways and things like that just for the extra security. And next slide, please. And we do modified steps and manufactured steps. So modified steps are a thing because, as you can see in that first picture with the gray, the white section was the original steps. So what we'll do is we'll kind of, depending on the needs of the homeowner, because these are all made custom to the home, there'll be longer and shorter steps so that it's easier to get down them. And then we'll custom make handrails. Sometimes we'll just put them down like a walkway and stuff, but we can also put them with the modified steps just so it's easier and safer for some people to get out of their homes, especially if we can't do a ramp and someone's not in a wheelchair. This is a great alternative. So those are a lot of the things that we offer for our Safe at Home. So if you have any questions, you can always reach out to us. You can contact me directly. There's my email or our phone number. Our phone number is 916-455-1880. Just in general, if you want to get in touch with me directly, it's just extension 9. Anyone at our office can answer any questions you have, send you an application, everything like that. And really, we ask that you share our program with your family, neighbors, and friends who may need these services. Like if you're walking with friends and you see that they're having a hard time getting out of their house, or they say, oh yeah, I was too nervous about falling, so I didn't take a shower this morning. Those are great people to say, hey, check out Rebuilding Together Sacramento, or any of the other resources that have been shared today. There's Safe at Home materials on the back table, and same with UC Davis Health materials and fall prevention materials on the back table that you may need. And if you need a speaker at any of your, if anyone still is working at any of your employee meetings, or if you have any groups that may be interested in hearing more about our programs, definitely reach out to Jennifer or I, and we'd be happy to talk with them. I think that covers it for Rebuilding Together Sacramento.
So maybe in a moment, would it be possible for us to review the Stop Falls Sacramento website? I don't know if it's possible to pull that up still. But in the meantime, we can also take some questions. Let's start here in the room. So I'll ask questions if anyone has any here in the room, and then I'll repeat it for our online audience. Right? Any additional questions from our participants here? Okay. How about online? Any questions from our participants on Zoom?
No, not right now.
Okay. All right. So if you wouldn't mind bringing up, I don't know if it's possible, the Stop Falls Sacramento website. Okay. So there are fall prevention classes offered here in our community, and I can tell you about a couple of the common kinds. So the first one is a class called A Matter of Balance, and it's a workshop series, and it's offered by quite a few agencies here in Sacramento County, including ACC, Senior Services. They offer the Matter of Balance class. So I know they're taking registration for their next class here this summer. So A Matter of Balance is an 8-session series. And it's 8 sessions, 2 hours each. And you're intended to attend all 8 sessions and cover in depth all the different topics we talked about today. We really just dipped our toe. And fall prevention, pun intended. We just dipped our toe into the topic of fall prevention today. So some of these fall prevention workshops go in depth on each of these topics. So Matter of Balance is offered by ACC. It's offered by UC Davis Health for UC Davis Health patients over kind of near the Med Center at our health education office. It's offered by Kaiser Permanente, and they do it at various locations around town. And I know theirs is open to anyone. So Kaiser offers it. Area 4 Agency on Aging is hosting it at various locations. So yeah, Matter of Balance is a really popular one. It's also being offered at some of the City of Sacramento community centers. So if you regularly visit any of the City of Sacramento community centers, say, hey, are you guys doing Matter of Balance? If not, you should, because we did train some of their staff. I know they've done it several times now at the South Natomas Community Center, and it's been very popular up there. So yeah, ask for Matter of Balance at your local community center, and then also go ask if your healthcare provider offers it. The good folks at Sutter offer a very similar class called Stepping On, and that's sponsored by Sutter Roseville. So that's more up in the Roseville area. The good folks at Dignity Health offer a Matter of Balance in the Carmichael and Citrus Heights area, and those classes are very popular. So lots of older adults living in the Carmichael and Citrus Heights area. So Dignity Health, Mercy San Juan Medical Center offers the Matter of Balance class. So I've just thrown a lot of agencies out there, but the good news is that they're all collected in one place on the Stop Fall Sacramento page, which is on the county health website. So Sacramento County Public Health Department hosts a website, that's it there, that lists all of these things. So the homepage kind of describes our Fall Prevention Coalition, but over there on the right side, I believe it talks about fall prevention classes. I confess I can't see that detail from here, but in the menu on the right-hand side, it'll talk about fall prevention classes. The last class I want to mention might really appeal to those of you attending online today. There's a virtual class called Bingo Size. Bingo Size. Everybody kind of laughed at me here in the classroom. It really is exactly what it sounds like. Bingo and exercise. It's a virtual class hosted by County Public Health and Agency on Aging Area 4. And they'll call out the bingo numbers, and each bingo number has an associated exercise with it. It's actually really fun because it keeps your attention as you go through. So yeah, there you go. Bingo size, hey.
I've heard good things.
Yeah, I've heard good things. It's really fun. So if you're a person who likes to attend class from home, if you're not big on driving out to places or you live far out, this might be a wonderful one to join on. So if you go to the Stop Fall Sacramento website, the classes will be there. So that's really fun. Bingo size. It's bingo and exercise. So yeah, there are quite a few fall prevention classes offered. Like someone mentioned in the room, it might be hard to convince our friends and family to go with us. So it's a lot more fun when you go together. So maybe offer to go with them, even if they're a little more frail than you or they need a little more help than you. Someone online asked a great question: how much do these classes cost, or do you need to qualify? I can answer for the fall prevention classes, and then I'll let Liz answer for the home safety services. The fall prevention classes, to my knowledge, are all free. Okay, so going to the classes is, as best as I believe, they are all free that I've heard of. I haven't heard of anyone charging them, even of all of the agencies that I just named. But yeah, I know there's some different qualifications for the home safety services.
Yeah, to answer that question, it's a great question. So for it to be free, you have to be low to moderate based on the HUDs. All the income breakout is listed on our application. And I think it's based on number of people per home. And I'll get to the actual question in 1 second, but I think if it's one person per home, it's about $56,000 is the max income of the household, and it goes up a little bit based on the number of people per home from there. We do have a fee-for-service option, and it kind of varies by what's needed. I wouldn't be able to say necessarily what every item would cost, but it would be approximately about $100 for a grab bar installation for the fee-for-service, which is still very affordable, and it is an option out there if you need it.
So, it's a, what kind of program is, you said it's a nonprofit?
Yeah, so it's the Safe at Home program.
But who funds it if
Yeah.
if people can't afford to pay?
Yeah, so as I mentioned, it's free for anyone who's low to moderate, and it's funded through a lot of grants throughout the city. Yeah.
Yeah.
So we get a lot of funding from organizations, from the city, from Dignity, Agency on Aging, ACC Meals on Wheels helps fund it, things like that, yeah.
But if you could afford to pay,
It's a small fee for service. Yeah, you would pay us directly.
that's a good way
Yeah.
to make some money.
Yeah. For example,
We don't make a lot of, we don't try and charge people, we just want to be able to provide those safety modifications for people who need them. I didn't repeat the questions, I apologize.
no, that's okay. The folks in the room were asking who funds the programs. You know, if it's free, then where does the money come from? But a lot of grants from government agencies and other agencies. I can give an example quickly. So taking off my UC Davis hat, just as my citizen of Sacramento Jennifer hat, my parents needed some extra grab bars in their home. My mom was getting ready to have a knee replacement surgery. So we knew that was going to be quite an event in the household, right? And she may need some assistance with getting up and down, especially in the restroom. So my parents were above the income qualification, so they would participate in, Liz called it the fee-for-service program. So they would pay to have the grab bars come put in their house. And I think one of the reasons they chose to go with Rebuilding Together was because they were an experienced provider of grab bars.
We do it every day.
They do it every day. We may have had some friends and family attempt to put in some grab bars, and
Don't do it. And do not use suction cup
yeah,
grab bars. Do not use those.
No suction cups, no towel bars, things that are just meant to
No.
be for your hand towels. No.
If you're using a towel bar, we can come in and replace that towel bar with a grab bar.
Yes,
And then
yeah.
you can use it for both.
Exactly. So it's nice to have a nonprofit service provider, someone that was experienced with exactly this service, and just someone that's trusted. Sometimes if you look up a contractor in the Yellow Pages or whatnot, you might not have any personal recommendations. So it's nice to have a nonprofit that does just this task all the time, which is the grab bars all the time. Yeah. But yes, putting back on my UC Davis hat, I will say it's nice for us because we often discharge folks from the hospital. And they are a lot more unsteady than when they came in, right? If you've had a surgery, an illness, you've been lying flat for even a couple of days or a week, can really decrease your strength and balance, right? So it is nice to have some place to refer folks for some of these home safety modifications, but we do encourage you to please sign up and get those done before you really need them. I will say, Rebuilding Together, they're fairly fast, but they're not there on an emergency basis. So try to get those, make some of those home safety modifications now. Yeah.
Yeah, as Jennifer mentioned, we can't, if you call us today, we're not going to get out there today. There is an application process. So as she mentioned, get these things done before you need them.
Yeah, and that is hard, right? We've discussed, some folks in the room have discussed, well, my friend doesn't think they need it, or they're not looking ahead. Today I'm fine. I'll always be fine. And I understand that. I don't want to overdo it on the fear of falling, right? But we do want to make some of those home safety improvements, which can help increase our confidence down the line. because we know we're safe in getting up and down in the restroom, getting in and out of the shower, getting in and out of the front door even.
Yeah.
So, yeah. Okay. Any other questions?
And to add to
Oh, yeah,
what
please.
you were saying, there's also community centers who often have exercise events and walking groups and things like that. So you can also check out your local community centers and see what they have going on.
Yeah, I love that. I'm on the email list for the Hart Senior Center downtown, and I know they have amazing walking groups, but not just there. A lot of the local community centers and parks and recreation departments have walking groups. From the hospital perspective, we would love if you walk as a group, right? Safety in numbers, for a couple reasons. One, it's just more fun to have people to talk to. But also, it's better visibility for cars. They'll see a group coming more than they'll see an individual coming. Also, there's someone there if you do have any sort of health emergency or other emergency while you're walking. It's nice to have some companions with you. So we love a walking group. Okay. Any other questions from the online audience? Okay. All right. So we will leave you with this thought. We've given you a big to-do list today, right? We gave you a lot of wonderful safety tips and encouragement about these fall prevention activities. Don't try to tackle it all today. That would just be too much to do. So if there's one or maybe two things that we discussed today that made you sit up and think, oh, that's me. That applies to me. I'd love if you would make a plan to try and work on one or two of these items. So what might it be? What did we discuss today that rang a bell with you? Was it getting back to an exercise routine? Was it making some of those home safety improvements? Was it getting your medication checked? Getting your vision checked? Right now that I'm going down the list, you'll see it's a decent to-do list. So let's pick one or two to try and tackle. Those of you visiting in the room today, you're already at ACC. We can go down the hall and sign up for an exercise class or two. So you've made a step in the right direction already. So I really appreciate you joining us today. Thank you so much for listening and for your attention.
Thank you, everyone, for joining us.
Thank you.